But overall, we still don't have the infection rate down as far as we need to. As in other countries, we have issues with the virus spreading in some hospitals and in care homes, and in some, the very clear advice we've received is that any change to our social distancing measures now would risk a significant increase in the spread of the virus. That would threaten a second peak of the virus and substantially increase the number of deaths. It would undo the progress that we've made to date, and as a result would require an even longer period of the more restrictive social distancing measures. So early relaxation would do more damage to the economy over a longer period. And I want to be really clear about this. The advice from SAGE is that relaxing any of the measures currently in place would risk damage to both public health and our economy. Patrick and Chris will be able to go into further details on all of this shortly. But based on this advice, which we very carefully considered, the government has decided that the current measures must remain in place for at least the next 3 weeks. Now, in terms of the decisions that lie ahead, we want to be as upfront with the British people as we possibly can. So let me set out 5 specific things which the government will need to be satisfied of before we will consider it safe to adjust any of the current measures. First, we must protect the NHS's ability to cope. We must be confident that we're able to provide sufficient critical care and specialist treatment right across the UK. The NHS staff have been incredible. We must continue to support them as much as we can. Second, we need to see a sustained and consistent fall in the daily death rates from coronavirus, so we're confident that we've moved beyond the peak. Third, we need to have reliable data from SAGE showing that the rate of infection is decreasing to manageable levels across the board. Fourth, we need to be confident that the range of operational challenges, including testing capacity and PPE, are in hand with supply able to meet future demand. Fifth, and this is really crucial, we must be confident that any adjustments to the current measures will not risk a second peak of infections that overwhelm the NHS. Now, today's data shows that 327,608 people in the UK have now been tested for the coronavirus. 103,093 people have tested positive, and sadly, of those with the virus, 13,729 have now died, and these are heartbreaking losses for every family affected, and it reminds us exactly why we need to follow the social distancing guidance.